All right, hello everyone, and welcome to today's Tuesday Times Roundtable. It's a pleasure to have you as always, and I'm very excited to introduce both of our moderators for today. It should be a very interesting conversation about a very interesting project. We have two people here with us today, Dr. Mark Padilla, who is an associate professor of anthropology in our Department of Global and Sociocultural Studies, and he's the principal investigator for this endemics project in the Kimberly Green Latin American and Caribbean Center. He's a medical anthropologist with cross-training and experience in public health, both domestically and abroad. And Dr. Armando Matiz serves as the project director for the same project, this endemics project, and is a trained dentist and holds a certificate in psychosocial self-help from the Association of International Facilitators, and he has extensive training in neuro-linguistic programming and hypnosis from the Clinical Hypnosis Institute in Michigan. So I'm glad to turn it over to our two moderators for today.
I think that's fine. So good afternoon, welcome, and it's great to see all of you. Thank you for coming on this busy day. And as Eric mentioned, I'm a medical anthropologist, and I work with the Latin American and Caribbean Center on various projects. And I'm going to talk to you about one of our kinds of sub-projects in a way, because we have a very large project funded for 5 years with the National Institutes of Health to study issues of drug abuse and HIV/AIDS in the Caribbean, specifically in the Dominican Republic, where we've been working for 3 years now, and we have 2 more years on this long project. I'm an anthropologist, and so it might seem somewhat unusual for an anthropologist to be doing a project that has to do with public health. And so I just wanted to say as an opener that I think for those of you that might be interested in the social sciences, a little pitch is that we really need more social scientists doing health-related research. So we do very interdisciplinary kinds of work on the Syndemics project. We combine ethnography, and I was just talking to Eric about a class that he's taking in qualitative methods that has a focus on ethnography. You may or may not have heard that term, ethnography, but ethnography is a qualitative method. It's not a quantitative method. It's a qualitative method that emphasizes being with people and being both kind of an observer of human behavior, but also a participant in cultural behavior, a social behavior, and that you learn from the act of actually being a pseudo-participant. We talk about being a pseudo-participant with different communities, trying to actually be out in the places that people exist and live and work, and thrive or not thrive. In the case of the people that we're talking about today, we're talking about a population that is really struggling. We're going to talk about heroin users in the Dominican Republic, and I'll give you a little bit of context about how we got into that, working with that population rather closely. But so the initial contextualization is just that we do more humanistic, qualitative research with populations, and then we try to understand how their situations and conditions of life contribute to health problems. And we tend to think about these things much more structurally. We think about them in large-scale terms, sort of what are the political, economic, social, and cultural factors that shape the ways that people are exposed to different kinds of health conditions and their ability to thrive or to get out of those conditions. So we were in the Dominican Republic for the past 3 years. We've been doing this ethnographic research on the ground, talking to a lot of people, interviewing them, trying to understand what are the factors that shape drug use, drug abuse in particular, and risk for HIV/AIDS infection. And we're really focused in this larger project on tourism areas. I could talk much longer in another talk, maybe we'll do that sometime, on the conjuncture of tourism and HIV and drug abuse, which is the mandate for our larger project. But because anthropologists are very flexible in our work, we approach our work in ways that try to emphasize discovery and new lines of inquiry all the time. You're always trying to explore new kinds of conditions and new situations that people are confronting, and to document those through field notes. So I'm telling you all of that because at one point, a couple of years ago in 2013, we our ethnography, our observation in communities, took us to a new population. We were doing an ethnographic mapping of institutions that work in drug abuse in the Dominican Republic, and there we found 36 of them, these different organizations that work in issues of drug prevention and treatment, and we were visiting all of them one by one and interviewing them qualitatively. And what happened is that we went to one organization that is called Fundo, and I don't think we have their logo here, but they're an organization that we've become closer to. And they are doing really good, hard work in a very poor community in Santo Domingo. If I can get this to advance, there we go. Which this is a picture of the barrio that I'm talking about, the neighborhood that I'm talking about in Santo Domingo, which is called Capotillo. And Capotillo is one of those neighborhoods, some of you may be familiar with the Dominican Republic or other similar locations perhaps. It's one of those neighborhoods that people say even the police don't go into. It's considered to be the stereotype of Capotillo, and a lot of it is a stereotype, is that it's drug-ridden, that it's gang-ridden, that it's very violent, that you just can't go in there. And the truth is, as with many stereotypes, it's just another neighborhood, and there's a lot of people just living there. They're living their lives. They are very poor. It's a very poor neighborhood. There are issues and there are serious problems with drugs in that neighborhood, but that's not everything that is going on. This is people, poor people just living their lives. Unfortunately, the slides seem to be advancing on their own. But so what we did when we went to Capotillo and we discovered this organization called Fundo that is in this neighborhood, and they are working with heroin users very directly, trying to do what's called harm reduction in public health. I don't know, has anyone heard of harm reduction approaches in public health? Okay, so you're probably familiar with, it's a different philosophy. It's not a philosophy of trying to say, just say no to drugs, kind of how Nancy Reagan said in the 1980s, right? Just say no, this is your brain on drugs, don't do it. Harm reduction is that you have to meet people where they are. If they are addicted to something, and an opiate like heroin is so addictive that you can't just, people who are addicted to it cannot just say no. They need support in order to not get even worse health conditions like HIV or hepatitis C. And so harm reduction approaches are the philosophy that until people are able to get off of their addiction, to become rehabilitated, we need to give them the tools to prevent them from having the worst harms. Yeah. And so those, I'm not quite sure, is it advancing on its own? Okay. And so Fundo is doing very good work distributing clean needles. They're clean injection equipment. They're distributing bleach and other cleaning kits for people to be able to clean their injection equipment. We could talk much more about harm reduction and the kind of work that Fundo is doing, but essentially what I wanted to tell you is the story that when we went to this local organization, there was a group of users there that are also kind of volunteers for the organization, okay. And they all said, nobody knows our story. We are invisible. We are invisible in the society. We are stigmatized by the society. We can't get clinical services of any kind. Drug users in the Dominican Republic, if they go to a clinical setting, they're often handcuffed to a gurney and the police are called and they go directly to jail. It's a very strong criminal justice response, and there's no real harm reduction response. There's no real attempt to try to help people to get out of their conditions. And so they said, we would like, this is the important part of the whole context, they told us, we would like your help to tell our story. We want to not be so invisible. We want to tell our own story, and we are ready to put our faces on that story. We want to be out there. We want people to know who we are. We want them to know what our conditions are like, our life conditions, and we want help to get out of our current situations. And there's a number of aspects of help that we will talk about. This is just a slide to give you a little bit of context because you may have all heard that there's a huge heroin epidemic in the United States as well now. And it's all over, but the Northeast U.S. has a particular epicenter of heroin addiction in particular. I would recommend, there's a documentary called The Heroin Trail It's available on YouTube, and it actually talks about a lot of what this is trying to summarize here, which is the change in the political economy of drugs, including heroin, that used to not be such a huge product in South America, but now there's cultivation of poppies in the Andes, in particular for export and processing mostly to the Northeast United States, and some of it goes to Europe. But the pathways of the trafficking goes basically from the north tip of South America through the Caribbean, right through the country. You may, if you're not familiar with the Dominican Republic, where all those shorter arrows are going on the right, the Dominican Republic is the larger island of Hispaniola right in the middle there. There's a lot of flow of heroin that is now going through the Dominican Republic. And officially, technically, they say that the Dominican Republic doesn't have a heroin epidemic. But as you will see, and what we'll show shortly, there is a very serious nascent heroin epidemic happening in the DR. And we'll talk a little bit more about that. So this group of individuals asked us to help them tell their story. And so what we decided to do, and when I say we, I'm mostly talking about Armando and I. Armando, I'll introduce him and pass the word on to him shortly. Armando and I have done before what's called a Photovoice methodology, and this is something that we're going to talk a little bit about today. But Photovoice is essentially a participatory photography approach, which is intended to help people to tell their own stories, and particularly it's used for marginalized communities that might not typically be heard in most of the standard ways that we would hear community voices, right? In the media, they tend to not be so much in the media. They tend to have lower levels of education precisely because they're so marginalized, and because of stigma, often people don't listen to the most marginalized populations. So Photovoice is a methodology that's been developed that takes people through a sequence of steps in which they learn about the technical and artistic aspects of photography, but they also think about photography within the context of policy change. So the big thing about Photovoice is that you want to try to create a gallery that is by the community, of the community, analyzed by the community, and then that gallery is intended to go out and circulate in public spaces. You might target specific audiences, specific policymakers who you want to change their minds about certain issues. And so we thought this was perfect for them because this is exactly the situation that they have. They feel they have no voices, they feel invisible, they want to take action to have attention be brought to their communities and their plight. So today we're just going to talk a little bit about this project, and I've already sort of started to contextualize it. We're going to talk a little bit more in detail about the Photovoice methodology. What is that and how does it work? What are the steps that you go through to develop a Photovoice project? It's something that I have a personal interest in disseminating because I think it's something that is relatively simple to implement in a lot of different communities, and it's something that everyone can access because pictures is something that everyone understands. We did it very simply with cheap disposable cameras. So we found cameras that were not so expensive because you don't want to have communities that are in a community like the one that I showed the picture of going around with very expensive equipment. That's actually a danger for them. So we had relatively cheap cameras, but Armando, who is a community facilitator in addition to all of the other things that Eric mentioned at the beginning of the presentation that Armando does, Armando is very skilled at doing group work, of managing group work and coordinating groups, especially in difficult circumstances. He's been doing that all over Latin America. And so we were very lucky to have him on the project to be able to guide this group. And he has been presenting, I know you're humble, but he's been presenting all over the world actually on how to adapt Photovoice methodology to drug-using populations that are living on the street. And we seem to have lost that. Did we touch this?
I haven't touched anything.
Yeah, it's very sensitive. So yeah, just to continue tooting his horn. So Armando was just in Brazil giving a presentation on the difficulties of doing Photovoice with active heroin users on the street. And one last little thing before I pass it on to Armando is that a lot of these individuals, as I mentioned, are homeless. They also often share these spaces that are sometimes referred to as shooting galleries. I'm not really thrilled about that terminology, but they're often abandoned urban spaces or areas that might be kind of construction sites, places that a lot of people don't go into, and people share that space collectively and they inject themselves collectively. So they share equipment and they share drugs in many cases, and they sleep and live in these places. So we were actually going to these locations to recruit people to come to this office, Fundo and do these regular workshops to do this project. You can imagine just those conditions of people being addicted to drugs and living under those conditions to be able to sustain themselves through a 2-year project to produce a gallery, which we now have circulating. So let me pass it on to Armando to talk about the methodology.
Well, once again, thank you for having us today. And I just going to try to explain better what happened in long period of time in this couple minutes that we have here. But what we did is just to train all these people, work with these people, the homeless people, and we just did something indoor training and something outside, and that's take us like maybe 1.5 years, and it was a really tough work because their condition is a kind of really a special condition, adversities, and all these kind of difficulties that we have. So make the time that we're planning at the beginning is just getting longer. And one of the things that we did there is we started just to create a kind of team cohesion, and that's implying that try to pull all these people together, because even all of them are in the same issue using heroin. Sometimes what happens with them is that they have a lot of controversial thoughts, so it's really frequent that these people is just fighting between them, and when you ask them come to the meeting at some time, they don't show up, or sometimes they come in under effect the drugs, under effect of the alcohol, or sometimes they don't have any eat before, having sleep the night before. So it's a kind of really complicated. So what I consider it was all the successful in this process is that we create the concept of the Photovoice family. That is different than try to create like a team building or this kind of concept. So what happened in this meeting is that we just sharing about all the personal condition, and we try to just protect ourselves in sharing about different things, sharing about our experience in the street with the police, with the people, of this kind of thing. So, and we also take food together and try, beside of that, just to build the training specifically about what is the Photovoice methodology. One of the biggest challenges was to approach the ethical aspect, because you can imagine people who are living on the street, they don't have any kind of normatives of rules, so it's easy for them just to break all the standard rules. So emphasize on all these kind of things was a big challenge. We also have some friends that collaborate with us and for photograph specific techniques training, and we use just camera creatively, make like a workshops. We just say that you are going to be the models today. So we use some customs and give them the customs, so they make up, and after that they just start to make like a session of photographs, and also they make some pictures into the organization inside, indoors, and that kind of things helps to provide them with all the elements to take a really nice pictures. I mean, that takes us like several months. We're planning to just do it in a 3, 4, 5, 6 months. At the end, it will stay like 1 year and a couple months more. The good thing is at the end, of course, we get the gallery. What happened is then they took around 80, 100 pictures, and we make a selection, a previous selection of that picture, and they select like 100 pictures at the beginning, and after that they make a selection of the 40 more. So this 40 was already is the existing the gallery. So we start over maybe 4 months ago, make the first gallery exhibition, in the community where these people are come from. And after that, we start to do it in a different place in Santo Domingo, in some NGOs, in one government institution. Now we are expecting to present it here. We are going to have the exhibition, the open, here in FIU in September 22. So I just take advantage and we expect to see you there. You can see this amazing gallery.
Yeah, just to, I think we have flyers here that maybe are circulating, but a week from today, the 22nd, it's a Thursday, I think, is we're going to have the full gallery in SIPA. So just to remind you that I think that starts at 5 p.m. and we'll have all of the pictures there. And another thing that we didn't mention, maybe Armando will mention it now, but is that part of the process is that every picture has an analysis. So the group themselves, you're going to talk about that? The photographers themselves have to come up with an analysis of the image, and their exact words are going to be in the gallery. So you know how the population themselves analyzes and narrates those pictures.
Yeah, one of the biggest challenges was when we was training them with the cameras, even these are disposable cameras, like in this picture you can see it, and some of them take the cameras and they sell it, and so we just need to replace the cameras. So I just want to mention that the difference, it's a long list of difficulties and adversity, but like Amar mentioned at the beginning, it's a kind of humanistic approach. It's something that I really enjoyed, because besides the complicated of this characteristic of this population, is so excited when you, like a human being, like a professional, when you just want to just give the opportunity to the community to participate. Well, this is one of the amazing experiences that I can tell you about it. This picture maybe is just to show you how this is one of the Photovoice family's member. He is in front of the pictures. We are making the analysis about the picture, because it was a really, really, really hard and difficult process, because we went to every single picture and just try to make an analysis about that, and also besides the analysis, make the alternatives for that picture. So it was kind of fun and interesting thing, because all of them just make a different perspective and different perception about that. And at the end, we just get like 10 different categories about what is the meaning of these pictures. And it's so exciting and fascinating, the way and the perspective that they have. This one is just to show you the first gallery that we made, and we decide we don't want to do any with a big wigs people. We decide to do it with the community, so they invite people from the community, and we get like a really simple room to get this gallery. And that day was really, really amazing, seeing people from the community participating, asking questions, and also changing the tag that they had for some people who are using drugs. When they see the drug users are protagonists of something different, when they are a protagonist on some social change. So it's like, wow, the community just start to have a different a way to think about it. This is just to show you really quick about, we decide to make a manual, and this is a huge manual. If some of you are interested in that, we will be happy to share it with you. And this manual will allow us just to have a guide to conclude, or just to follow every single step into this process. But it's Photovoice. At the end, Carolyn Wong is the person from University of Michigan who created the Photovoice methodology, and she described that methodology under this SHOWEL, that is acronym to support people to make a big analysis about the pictures that they take. So let's say, for example, what do you see in this photograph? What is happening in this photograph? Or say, how does relate to our life? Why this terms is sustainable? Or the word, how can we succeed in these themes in our life, and consider an aspect important like education, or what can we do to approach in this team. So she just make this kind of question to support people from different communities to make analysis about the picture that they took. That's what she described in Michigan, but we are just making easy to them. What I would say is that we say, what do you observe in these pictures? And also, what is the analysis? What do you think about that? And also, what is the action that we need to take care? So 3 different steps, including another 6 focus questions that Caroline one suggests for the analysis of the narratives. So we want to say the picture speak, and the way that we can make the picture speak is, of course, go to this process and answer this question. What I would do is then make a groups of people, the Photovoice family, and they make a description, answer all of these questions, and after that, just go individually and just make the final adjustment to get some final that we call narrative. So each picture is just have one small narrative. This one is to show you one of the pictures that they took. This guy is passed away, unfortunately, already, and I really consider this picture one of the best. It's so amazing. You can see the place when he's laid down, but also the muñequito beside that. These are kind of cute things. And what is the meaning of that? They will be interesting to see and observe all single detail about this picture. So maybe when I show you the next, you are going to see what I'm trying to say. For example, in this picture, you can see at the beginning the title of the picture. Also, below you can see the analysis of the picture, and at the end you can see the alternatives of the picture. For example, this picture you can see they say mi vida sobre el espejo, my life on the mirror, and then show some of the conditions that these guys are facing. For example, this person doesn't take any access to the public health system, and like him, is 2 different kind of pathologies between this community that make you feel like, wow, what happened with us? What happened with this our system? How we can participate in that? It's something that personally moves me inside and say, well, we need to do something.
I wanted to just add to that a little bit, that obviously some of these pictures are difficult to look at. They chose to take some pictures of themselves using and injecting, and then also the consequences. These are abscesses, which are the product of unclean injection equipment. And so over time, there's a lot of infection that occurs and in unsanitary environments. So if you're using harm reduction approaches that I mentioned earlier, you wouldn't see these kinds of abscesses. There's still challenges that people have with their veins and their skin, but usually if you're in sanitary conditions, you wouldn't see this kind of consequence, but we see a number of pictures that are somewhat challenging to see. I would also just mention that when we do the actual exhibit in a week, we're going to have both English and Spanish. These slides have some Spanish only, but we can translate them too, but I think Armando already did that one.
This is another picture, example of the picture. I really love that because they say, we don't have, the lock doesn't have any problem. The problem is the door. So this is another, that show clearly many places where these people live and their condition or they live in. And it's like a fake work. Because like at this door, it doesn't work. Anything works for them. This one, for example, also, my work, and that shows how people of different age are involved in this problematic drug use and also the social discrimination. This one to show how the corruption, the police are involved and how they make a strong piece of this problem, because the police also they don't receive a really nice salary, so the police need to looking for survive too in some way, And some of the way that they decide to do is the same time use the drug and just place the drug to some people who doesn't have any, make them guilty, and so the whole corruption process start in that. So many people who are using drugs on the street, they just say and accuse the police like a big piece of this problematic situation. This is another picture to show how they survive, because of course the drug users need to get the money to pay the doses they call la curita. That does mean they need to just get the drugs for daily, twice, some once, some 3 times. So one of the things that they do is just working with the trust, of course, the conditions. So it's now this is a vicious circle.
Yeah.
To
And one thing about that observation that Armando is making that's important in case you don't know about this, when la curita, what they call the daily cure, the curita, is really a apt phrase, because when you're addicted to heroin like they are, they're not actually getting high. What they're doing is just trying to inject the minimum amount of drugs to take the pain away for the abstinence illness that sets in when you stop taking it. So they're never really, it's not a euphoric experience. It's an experience just to sort of survive, because, again, I'm not sure how familiar people are with heroin addiction. When you're really addicted, you can die if you don't, you can die from the withdrawal. So you can't just go to some of these criminal justice responses that say just throw people in jail. People have actually died in the DR from being taken off the street and thrown in jail, because then they have the withdrawal symptoms, and you can't do that. That's why you need clinical treatments like methadone, Suboxone. There's new drugs that are coming out and becoming more available in the U.S. But those treatments do not exist in the Dominican Republic, not just because of poverty, but also because the law is so strict in the Dominican Republic that methadone is considered is equally a narcotic as heroin is. So it's criminalized in this. If you're caught with methadone, not with heroin, but just with methadone, which is a treatment for heroin addiction, you can be thrown in jail too. So there's zero access to this what's called opiate replacement therapy. And so when they say la curita, what they need is to get the smallest amount so that they just can diminish the pain. It's almost like a painkiller, but none of them are really getting high with that.
Yeah, and another thing beside that is that they start also to mix the heroin with another substance, and then they call pitbull right there, and also does interfere with the quality of the drug. This one is to show you that also how just men, women, and even people who are with another illness beside the drug user are participating in this process. I mean, to be on the street begging and asking for money. And of course, when you remember the picture at the beginning, this picture is not in this area. Of course, that implies that people need to migrate from their place where they live into the northern area in the city to looking for their survival, looking for the curita, and come back to the Capotillo. And some of them, part of the discussion was really interesting because some of them agreed with this behavior, and part of them said, no, this is absurd. This is one way to abuse, abusar de la comunidad.
Take advantage of it.
This is one way to take advantage of the community in general, using our bad health to ask for money. So it was a really controversial point, point. So that's what is that picture show here. People living in the street is nothing. The good about this picture is the analysis that they make when they say, for example, these people is inoffensive for the community. The problem with these people is that they are just using drugs and they are victim of the drug using. But the way that he is sleeping, his shirt is clean, he's sleeping, giving the back to the war. I mean, if they have some problems, they wouldn't sleep giving the back. They would be like in alert or just be, attend what's going on. But it's part of the interpretation. The way that some of their children live. This is the way that they were created. And of course, it's really, really complicated. You can see in this picture at the beginning of this tube is a piece of wood, and they place it because the tube just suction people and have been taking the life of some of the children. This one looks like a normal picture. Is not. For me, it's so really, really interesting. People who are living in these places are people who provide the drugs for the other users, and the community around these houses, protect people who are living in these houses and protect these houses because these houses and people who living in this provide everything people need in the community, things that the government never do. So they protect them from the police when the police come to make this, to check for the drugs and how the commerce of the drugs, and they just hide people from these spaces. So providers are the most important figures into the community. This is a picture to show the kids, and they say, like, this is a future without definition. This is the title of this picture, and it's something that concern. It's a big concern because many of these people who are using drugs in the street have a lot of children, and I would say, what do you think is going to happen with the children? So this is one of the most interesting picture to make analysis and to see how people could participate in that. Us. This is just to show you the different categories that come from the analysis of these 40 pictures. And well, I just maybe just leave here and make a discussion because.
Well, yeah, I think the only thing to focus on here is that, again, Armando and our group was just facilitating a process for them. So this is all their product. We, of course, made it nice in a PowerPoint slide. But they came up with this idea of having, on the one side, kind of negative factors, sort of factors, and one thing that they thought was a major theme is just the issue of stigma and discrimination of the community. So kind of difficulties or challenges on one side, and then positive resources or assets or resilience on the other side. And they wanted to be able to show with the gallery both sides because they don't want to just give a negative image of everything. They wanted to have positive images, and they wanted to also have alternatives, which is why you see in each of the captions it says analysis, and the analyses tend to be rather bleak. But then the alternatives or the sort of solutions, right, is the second part that comes for each of those pictures.
Yeah, even for us, some of the things sounds like a negative. For them, seems like it's a positive thing. For example, people who are looking in the trash. Some of them say, well, this is our job. We need to do it. And some of them say, even, I like it. So, okay, it's the option that they have, or the recreation for the kids. This is the only space that they have, so it's the only space that they can take their children, things like that. Of course, it's not like an ideal, it's not like a good thing, but for them, when they make the analysis and try to make a balance, they say, at least we have this option. And some of them say, we live better than another people. So I can imagine how is that. But for example, when Mark mentioned to you the shooting gallery is something that really, really have in my mind and in my heart to do this work. One day we went to these places, I just was noticed one of the girls, she needs really quick the curita. And so they were sharing in the same tapita the drugs, so they start to make a little bit and they're sharing between them. And this girl, she doesn't have any possibility to get her veins because too many, ¿cómo dices?
Vein.
No, pero no conseguía la vena porque la habían pullado mucho ya.
She couldn't find
too many times. So the way that they make solidarity actions to resolve her problem, it was something that really you could believe it. So they take her and help her to her neck in this way, and one of them come to this way, and another one to be in her leg. Something that I never have seen before, and something really, really impressed. But I, what I mentioned about this experience is the way that people create solidarity between the adversities between them. And so made me feel like how people like me could create solidarity with a lot of opportunities that we have. So it's something that I just want to mention. And this one is really quick to show you the Photovoice family. One of them, this guy I'm sorry, on the top, and maybe at your left side, he passed away. Tú puedes leer, you can read what they say in Spanish and in English when they just want to show their face. And you can see the happiness, even the situation, you can see the expression in their face, participating in this. And now, this guy in the middle of the battle, tomorrow, we get some support, and he's going to be in a clinic, and she's going to get a ophthalmologic surgery. Hopefully he doesn't lose his eyes. And well, all of them have different kind of history, but so far there is the Photovoice family who make that project possible.
And I should add, I think, or we should add that this has really been kind of an intervention for we didn't fully realize, but seeing those faces again, it reminds me of how important this was for that group of 7 people to have some sort of purpose and to have some sort of voice. Obviously, the point of Photovoice is not to just leave it at the gallery. What you try to do is actually create conditions for social change and for policy change, which is what we're trying to do with the galleries moving forward. But just for these 7 individuals, it's been hugely important. And maybe Armando can say a couple of words about what they want to do now moving forward.
Yeah, they had been feeling like they are different person because this process make them that they are valued, that they are some person that people admire and people believe in them. So that small, like that kind of input make inside of this person just to start the transformation. For example, this person, his name is Carlos. He's part of the Photovoice family. He has in the street like this, and he's already working in a call center in Santo Domingo. I need to say the truth. Carlos has been working in the call center, and sometimes he had been back into the drugs. But the point is that he's struggling, that the society and people like us give him a little window opportunity. So it's a possible for a human being. So, but it's just Carlos. And how many people are in the Carlos condition? What else we need to do? How we can participate? And how we can just show people that another way. Like say drug use is a sick, is a illness. It's not like a bad behavior that is different. And when when you perspective and you're clear about that this is a health issue, you can treat these people like you treat people with another illness. And so this is part of the thing that we are trying to do. Well, maybe this one just to show that Photovoice is a methodology. We are using this methodology now with a drug user. When we make it also in Detroit recently, comparatively with another community members, like gangs members or sexual workers or LGBT population or transgenders living in the street. And the Photovoice always allow us and allow people to participate in the social transformation thing. So We can use Photovoice also into a school in different categories. I have here a lot of things about bullying, a lot of things about arms, guns, a lot of things about violence. So this is a kind of neat methodology that we can just learn more and use it for another issues. And well, it's so exciting. I could say a lot of things. They tell you just try to do it like this, but I would like to give you the opportunity, and maybe you have some question or you want to learn something more specific about the methodology, or just to have some minute to open conversation. Esa es una pregunta bellísima. Te agradezco que la hayas hecho porque si salió de tu mente, de tu corazón esa pregunta, es muy significativo la razón de la pregunta. Y lo que hace el cambio es la respuesta de la gente alrededor. People surrender the drug user, then they show him or her that we are open to understand you, and that we are open even to listen to you, not necessarily to give you clothes or give you money, but we are in the same symphony than you are. And that makes you feel like, well, my life is valuable and I am ready to do something for my own change if you give me this a little open window.
And I would add, as kind of putting my public health hat on, because I'm an anthropologist, but I have a master's in public health, and I've been teaching in schools of public health for a number of years. There's also been a shift in public health philosophy since the late 1980s, more or less, because a lot of parts of the world, especially in the United States, we led a very zero tolerance kind of approach to drugs, which was just tell people no, just eliminate, you have to have a strong criminal justice response. That was the initial thing. Public health people working around the world started to show with evidence, for example, you can track things like IV drug-related HIV infections or hepatitis C infections, and you can see when you implement harm reduction philosophies, because there's some countries in the world like Portugal that has a fantastic system for harm reduction. So you take people off the street and you give them the equipment and the education and the institutional support to actually get la curita, what the Dominicans are doing on the street on their own, in a clinical setting that is hygienic, and you educate them about how you can wean yourself off of the methadone or whatever the clinical treatment that you're receiving is, and then reduce your risk dramatically for all kinds of health conditions. So when you see a policy change like these legal changes in Portugal and other parts of the world that have implemented these harm reduction approaches, you see the plummeting of HIV infections and hepatitis C infections and deaths from all sorts of causes of mortality. So public health people really for a long time, for at least 30 years, have had solid evidence that treating it as an illness and treating it in clinical settings with public health approaches is effective. The problem is that socially, when that information tries to get communicated out of the elite kind of academic world of public health into the public that votes on policies and that sees harm reduction often as permissive approaches to people that are using drugs, so they see it as, well, no, these people, they're irresponsible. They need to be shaken up. They need to be incarcerated. That's the only rehabilitation there is. And we could talk for a very long time about how much circulating stigma there is about drug users in particular. When we've done some of these workshops, we ask people what their first thoughts, before we talk about all this stuff, what are your first thoughts about a drug user? You will see if you have that, an unprimed discussion, people will come out with all kinds of stigmatizing ideas about what a drug user is. But the truth is that nowadays we have grandmothers addicted to prescription medication, and they're not conforming to the stereotypes that people have of who a drug user is. We have a massive pharmaceutical addiction epidemic in this country and all over the world. And so it's really about kind of shifting the way that we think about drug use in general. And I think public health has been leading that for a very long time, but there's been resistance because there's a lot of ideological and moral resistance to the idea of taking a more health-related approach seriously. Because if you take that seriously, you really have to change a lot of our policies. And you can't just throw people in jail anymore, which is really what we've been doing for a long time. And the Dominican Republic has kind of imitated our United States approach, the legal and carceral approach, and they've just put it, to use a bad metaphor, on crack. Like, it's just really crazy because even if you have methadone or you have something that is an attempt to try to get off of drugs, you still get thrown into jail. So I think it's been around for a while. It's a great question. It's been around for a while, and there's a lot of ideological resistance to actually thinking about it as a disease. And I think it's important for people to really try to reframe that and think about what does that mean. When you say things like people need to pull themselves up by their bootstraps and get off of the drugs, do we say that to a person with cancer, for example? Do we say that to someone that has diabetes? Like, just get over it. Like, we don't do that. We don't have that gut level response. And with people that have are addicted to drugs, we often do. Yeah. Yeah, I think I certainly think that we have to think about it in global terms. And one of the things that we've been struggling with this project, and we'd be happy to have your suggestions, because that's part of what our purpose was, is to get some feedback from you all, but is how do you take something like a Photovoice project in the Dominican Republic and make it meaningful to US-based audiences? In Miami, I think it has more access because people know the Caribbean to some degree. The DR doesn't seem that far away. But the reality is that it's all an interconnected system. And the drugs that flow through the Dominican Republic that are addicting the people in this project are flowing up to the Northeast United States. That's the reason that we had that map with the routes. It was thought that the DR was just a transit country, but now we're seeing a lot of local use. But that same traffic is what's coming up and is now being consumed by middle-class white, not just white, but there's a lot of media attention now to the young kind of white college-aged kids that are becoming addicted in Vermont. And I think that it brings a little bit of a kind of shock to people because that, again, isn't the stereotype of what people have in their minds of who are the populations most affected. But I think that one thing we're trying to make sure that people understand is that when you put it in global perspective, what's happening in the DR is very closely connected to what's happening here.
Yeah, exactly. Yes, to say the social and structural factors that are affected or are surrendered this group is basically the same in any place in this world. So what we are trying to present also using in this project is to take this Photovoice family like example and how they can participate in a social transformation, not just in Dominican Republic. We are just ready to present that this is a reflecting situation in this island could support another places. So thank you for that. Yeah. One of the things that I consider, because it's of course this is a branch of things that we could do, but based in this experience, precisely, one of the things that we need to increase is necessarily the education in the different levels. Because even if we go out to talk with some of our friends out of this room, you are going to see clearly that people don't necessarily know exactly what is the meaning or the significance of this problematic. So in this point, I personally don't make them guilty because they don't know. It's like a HIV years before. When the people, they don't know about what is HIV clearly, everybody was scared, everybody wanted just to reject another people. As soon people start to get educated and understand what is the problem in real, the people start to just calm down, understand better, participate better, and think. I think that the drug use, this is a big, huge thing. It's not just heroin, it's not just opioid. You can just say marijuana, you can say crack, cocaine, wherever. At the end, all of them is under the same umbrella. In education, this is a big piece, but it's just one piece.
Yeah, I mean, I think one small thing that we're trying to do through this project is to bring it to Miami. So we're starting, and if anyone is interested in participating, we need help because really this project started as something that was a side project. It's not actually funded. The larger project I mentioned at the beginning from NIH is funded, but this was a side project that we developed, and we got a little bit of seed money from LAC to do this, what you're seeing here, but we don't have any funding right now. And one thing that happened is that one of our team members linked us up to a Miami-Dade teachers training program, and we went and delivered this to Miami-Dade high school teachers. And it was very interesting because they all want to have it in their classrooms. They all want to have these kinds of discussions to happen. I think they really like the humanistic aspect of it because it's not just talking about charts and graphs of drug addiction or kind of rates. People can't think that way, I think. And in a lot of ways, when you talk about drug abuse, people are kind of oversaturated at this point, and what they hear, especially young people, I think, is they hear the same old Nancy Reagan just say no thing, and they check out. They're just not a part of the conversation because what they hear is the old standard, oh, we're talking about drugs again, so it means like just stop using, and the same messages that have been traditional messages that we've always heard. This comes out of that, it leaves that domain and is more humanistic. It's more about these actual images and experiences, which I think is more accessible to people. And then having this harm reduction kind of approach and teaching young people about what that means if you take it seriously. And then also taking seriously that we have a problem of stigmatization of drug users in this country. Like we think about them as, at the very best, mentally ill. And at the very worst, the worst outcasts and cause of all problems in society, which is what generates things that are happening and that you mentioned, the social cleansing tendency comes out of this intense stigmatization that everything that we have going wrong here is about people that have these personal failings and then fall into drug abuse. So reframing that by presenting human beings and human stories and helping people to understand that people aren't really trying to be high all the time. They're trying to get off. These 7 people are desperate to get off of heroin. They're just desperate. And they don't have the social supports and no clinical supports of any kind to be able to do that. So we've been working with other institutions in the DR to try to change the law because there's a group of policymakers that are trying to shift the law so that you can have clinical treatments for opiates. And we're participating with this gallery in those discussions to tell people what happens when people don't have access to it. But I think a long-winded answer to say that there's things to do here in Miami, right locally at FIU and in maybe Miami-Dade high schools in a different way, and we're trying to work on that. If you're interested in it, please do let us know, and we'll put your name on a list, and when we have more concrete activities going on in some of these high schools, we'd love to have you come along with us.